most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together, we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today, we're going to talk about should you rest a hip that is painful? So let's go right into it, Brad.
That's right.
The answer to the question really depends on your diagnosis.
Right.
So, obviously with a hip fracture where you might need surgery or a complete muscle tear,
Right.
then you're probably going to, yes, you have to rest and you may need surgery. But with a hip strain where you tore the muscles, maybe a mild tear, tendonitis, bursitis, even a fracture that's they're not going to do surgery on, you're going to not, there's no need to rest completely. There'll be conditions that we're going to have you to work on.
Right. I mean, assuming you've already seen a doctor and had the diagnosis, the doctor should give you some indication. Can you put weight on it, partial weight bearing, or weight bearing as tolerated? In other words, if it doesn't hurt so much.
Right. And we'll talk a little bit about that. Also, I forgot to mention arthritis. Now, it really should not rest arthritis, a hip with arthritis.
Right.
Because movement actually helps create the synovial fluid, the kind of the oil for the hip.
the lubrication.
Lubrication.
Assuming it's within reason and it's
again, controlled. Well, we'll go through all that. So
exactly.
So the first thing, we got kind of 5 conditions here that we want to talk about. Number 1 is hip movements. So we still want movement in the hip, but it should be controlled.
Sure.
And it should be limited to pain-free movements.
Yep.
Now, we'll give you just one example of that. Brad, do you mind just showing
absolutely
trunk
not.
rotations here?
Yep. This is a nice way to work the hip because it's not very aggressive.
Yeah, it's very controlled. You can do it right when you wake up in the morning, before you even get out of bed, and again throughout the day.
So we're talking hook rotation, right? So the legs come up in this position, so the knees are bent. The weight is resting through your feet on the bed or the floor, and then you're going to keep your shoulders relaxed to the floor or the bed and simply start rocking back and forth. And right now, my hips, the balls of my hips are moving in the socket, and we're getting some motion, but it's not weight bearing, it's not aggressive. And you might find that one way, well, it feels okay, but you go the other way, and you may get pain in one or both of the hips possibly, but usually one's worse than the other, depending on your diagnosis, of course.
So if that's the case, Brad, what do you do?
Well, good point, Bob. I was ready to take a nap.
Yeah.
No, I was just kidding. But yeah, you go to the pain-free side. If there's a little stretch pain, but it's not bad, that's okay. Use good judgment. No sharp pain whatsoever. So work the pain-free side and don't go the other direction. Just bump into that pain where it starts to hurt and then go back and forth. So you're going to work, in my case, it's to the right, and maybe do 10 of those. And then go back to the left and see if you can go a little farther that way. If you can, go ahead and take it, but don't push it too hard. This is something you're going to come back to later in the day or the next day, and you should be able to loosen it up as time improves.
Yeah, it's good. And arthritic hips really love this one generally. So, all right, Brad, you can sit up now. I'm afraid you're getting too comfortable.
Well, I thought maybe I could take a break
when
you talk.
This is a good time to mention, Brad, that if you just happen upon this video on YouTube, it's actually a part of a series of videos on hip pain.
Right.
So what you do, if you want to check out that series, you go to bobandbrad.com and go to the program section and look for hip pain.
So we've got a number of hip videos, all about 10 minutes long or so, with different recommendations, whether it's range of motion, strengthening, how to address.
They'll go into more of the hip movements.
Right.
For one thing.
So it's like looking at a playlist or a series.
If you're going to have a surgery, what you should ask the surgeon.
And then with the exercises or whatever recommendations are, we have a PDF printout. So you can look at it, print it off on your printer at home and set it off to the side so you can use that for a reference.
Yeah, just watch the ones that you feel pertain to you. You can see the titles.
Yep.
And it's free.
Oh, yeah.
It
really is.
We don't ask for email or anything. So, all right. The next thing we want you to consider is your hip is painful. You really may want to reduce your weight bearing. And that's what Vero said. Especially if you have a fracture and the doctor might say, hey, you're going to reduce your weight bearing for
Right,
a while. And we're talking about how much weight you're taking through the hip.
Right.
So you may want to use a cane, a crutch, a walking stick, a walker. You want to avoid hills and stairs maybe for a while.
Yep. Yeah, and if you haven't seen a doctor and you've got hip pain, you're going to have to follow the rule of thumb. If you get sharp pain with it and it's consistent, you got to stay away from it. And that means you probably need to see a doctor and figure out why you're getting that sharp pain.
And, we really do want you to keep walking, but we have found quite often that when people come in to see us with hip pain, if they use a cane for a while, sometimes it calms the pain down.
Sure.
And they can then proceed without it, because we get a lot of pushback on using a walking stick or a cane.
Yeah, people, that mid-range, you're getting your 50s or 60s. I'm not ready for a cane yet. But but if you can walk with a cane and it takes the pain away, then you're okay.
You should do it for a while.
Yep.
All right, then number three condition, is we're going to prescribe exercises, and that's where you're going to want to go to the Bob and Brad program section. These exercises will be performed and progressed, and you'll find out that it's amazing. If you strengthen a hip and if you stretch a hip, it can often improve the pain greatly.
Right. And you always want to get the range of motion expanded first,
Yes.
and then you start the strengthening. And that's just a standard therapy protocol.
The other thing that we emphasize is that number 4 is that you really want to avoid certain activities that are painful. Like you said, stairs, you may take them one at a time because I'm sure you still have to go upstairs. But like, let's say you're doing something like you're mowing the lawn with a push mower and it hurts a lot when you're doing that. Find someone else to do it right now and avoid the activities that are pain makers.
You're right.
We'll have a do's and don'ts list on one of the videos.
So going upstairs, sometimes you can if your right hip hurts, but if you go up with your left leg first, one step at a time, that can clear it up. And, that's a good strategy.
All right. The final condition is just really follow the golden rule for hip pain. Don't do anything that increases your hip pain right now.
Yep.
Especially greatly if you can avoid it.
Right.
That is, I know some things are unavoidable, but we wanted the hip to calm down. It makes a big difference.
And that's pretty much a golden rule for all therapy. Some people think that no pain, no gain. You got to get through the pain and it's going to get better.
Right.
Typically, that's pretty rare. There's occasions, but not the case.
All right. Thanks, everybody, for watching.
Good luck with that hip.